Most people have either been a patient at a hospital or gone to a hospital to visit a sick friend. Many times when you enter the main door of the hospital, you are greeted with masks and hand sanitizers. Have you ever wondered why this is the first thing you see? Hospitals tend to be a breeding ground for unwelcome bacteria. Mark Stiebeck and Associates state that there is microbial contamination on surfaces in both patient rooms and treatment locations even after cleaning occurs. According to Cooley-Dickerson Hospital, approximately 1 in 20 patients will acquire a hospital-acquired infection. Most of us think we go to the hospital for treatment and for healing, when in reality, there's a possibility that we will acquire an infection while we're in the hospital. So the mask and hand sanitizer mentioned earlier are not only precautions for the visitors, but for the patients as well. An act as simple as hand washing upon entering and exiting a patient's room can reduce the spread of bacteria and reduce infections. No one wants to be a patient in a hospital, but if it is necessary, it is important to do your homework and know that you're in a safe environment and steps have been taken to reduce hospital-acquired infections. There are all kinds of jokes, but the one that is most closely related to this subject is there were 2 men sharing a hospital room and each were laying in their own bed, and one man asked the other, "Is this hospital any good at treating pneumonia infections?" The other man stated, "Oh yes, I got mine here." Unfortunately, that is a true statement in many cases. Do you know as a patient where you would go in case of an emergency? Or if you were in need of surgery, where would be a safe place for you to go for treatment? Most people don't think about that until it's too late. We need to be educated consumers when it comes to health care. Hospital-acquired infections are the #1 cause for harm to patients today. Fortunately, there are hospital safety rankings and ratings for infection rates that provide very detailed information to the consumers. They can be found on Leapfrog or hospital safety score websites. The scores are updated twice a year, so that keeps the public informed on the latest scores. The hospital safety score uses national performance measures from the Leapfrog Hospital Survey, the Agency for Healthcare Research, and the Centers for Disease Control and Prevention. The performance measures produce a single score representing a hospital's overall performance. The ratings are easy to interpret as it follows the A, B, C, D, and F model that the education system utilizes. So obviously you would prefer to go to a hospital that has a score of an A or B rather than a D or F on infection prevention. So now that you've done your research, identifying a hospital that has a low hospital-acquired infection rate, do you wonder what differentiates an A ranking hospital from an F ranking hospital? Well, after research, it is found that the usage of robotic cleaning method that uses ultraviolet light to remove contaminants from surface in healthcare facilities seems to be the answer. Healthcare facilities that utilize ultraviolet light cleaning, in addition to the traditional cleaning methods, have seen a huge reduction in hospital-acquired infection rates. This method of cleaning allows cleaning in areas that's very difficult for people to get to with cleaning supplies and a rag. Ultraviolet light destroys bacteria by breaking apart the DNA. Once the DNA is broken, the organism can't function. It can't reproduce, and therefore it dies. An ultraviolet light disinfection system generally increases the time it takes to clean a room by about 30 minutes. That seems like a lot of extra time, but it is absolutely worth it. The extra time it takes to utilize the ultraviolet light for cleaning can be the difference in life and death in many instances. Patients have higher morbidity rates and mortality rates if an infection occurs. An article in Infection Control stated that a hospital-acquired infection will increase the patient's stay by about double, which in turn will double the total healthcare cost for that stay as well. As discussed, utilizing ultraviolet light seems to have a bearing on the reduction of hospital-acquired infections, but there are safety hazards to the patients and visitors that go along with this type of cleaning if not done appropriately. So this brings up a question. Are hospitals reducing the infection rates but increasing the chance of harm by ultraviolet light? Ultraviolet light is known to be harmful to human tissue and can lead to skin cancer and cataracts in the eyes if prolonged exposure exists. Appropriate training completed before a person is certified to use this kind of cleaning system is necessary. The process entails placing the robot in the room, shutting the door, and operating the cleaning system from behind a closed door. Once the process is complete, the robot turns off and it is safe to enter the room. The robot works in a dark room, so the blinds on the windows need to be shut if there is a window. If the door is opened, the light triggers the robot to automatically shut off, and therefore the ultraviolet rays do not come in direct contact with the person. In conclusion, it is important to research healthcare facilities before becoming a patient. Hospitals are striving to eliminate the spread of infection by utilizing industry-standing cleaning practices. Ultraviolet light, which is harmful to microorganisms, has been used for decades in food, air, water purification, and the sterilization of laboratory equipment. Expanding this technology and practice to the hospital setting has made positive strides, reducing the hospital-acquired infection rate.